You're watching CTOM TV. Knowledge is power.
So the oncologist is still going to say, you know, we've looked at everything. There are no targeted therapies for this. So how would you respond to this? Well, the first thing you say to them, you say, are you just referring to FDA-approved approaches? Or are you referring to different approaches? What is your data for saying this? You're saying that this cancer doesn't typically respond to targeted therapies. What is your data for that? And then you ask them, you know, are you referring to just FDA-approved therapies? Have you considered sequencing and sensitizing mutations in this cancer, or are you just referring to the type of cancer and targeted therapies? Are you referring to desensitizing mutations? In other words, mutations that would prevent a certain targeted therapy or chemotherapy from working? Are you referring to targeted drugs that are off-label, such as a BRAF mutation in a colon cancer or a lung cancer? In other words, you have that mutation. Most people with this type of cancer don't have that mutation, but I may respond because patients that take drugs in different cancers that have BRAF mutations have responded. So maybe I will respond. Are you considering that too? Targeted off-label. Also, have you done any recent peer review research? This is a very important one because a lot of doctors like to feel that they're up on things. But let's give a context here. I mean, there's about 300 different yearly conferences on cancer. They're all based on specific targeted mutations for the most part. Very few include general chemotherapy drugs. They do, but that's not a big part of it. Most of them are specific to a molecular subset in a specific type with a specific combination of drugs. And so 300, some of those, the ASCO last year had 7,000 different presentations or
just
abstracts. One conference. So you multiply, that by 300, you could see the data is overwhelming. And so your doctor that barely has enough time to spend 30 minutes with you and look over your medical records, have they really done a proper peer review research and looked at all of these based on your molecular features? I seriously doubt it. Also, you want to ask them, have they consulted with other doctors outside of their institution? Have they talked to Mayo Clinic and said, hey, what are you guys doing for patients with this type of cancer and these molecular features? These targeted features that this patient has.
Okay, but let's back up the bus. Let's assume they don't have any of the molecular feature information. Let's assume the answer to have you done these things, the molecular profiling, the tumor DNA sequencing, inherited mutations testing, let's say the answer to that is no.
Well, then you have your answer.
What? My answer is?
What their question is a moot point because they don't have the data.
So
what is their data is the question.
Okay, so if they haven't done these things,
they don't have enough data to say that.
Okay, got it.
Ask them if they've consulted with their doctors from different communities, different hospitals, and then ask them if they've looked at patient case studies. So if they're saying this and they've actually confirmed to you that they've gone through this checklist, then you can believe them. But I guarantee you, most doctors won't even get past the first point. So that's how you address that question.
Okay, right.
Show me the data.
Right, so going in with your list of what data is possible to gather, all those things I listed off, and Alex did.
Have they investigated it all?
Have they looked at all that? Because if all those things haven't been considered, you're almost certainly leaving options on the table.
Exactly.
Or what they're saying.
What they're saying is just not true.
They don't have the data.
They don't have the data to say that.
Right. Yeah.
And they need to retract that statement because they don't have the data to prove that they've done that research to say that.
So it might be true that they themselves don't know of any other options, but that doesn't mean that there aren't any, and that's a big difference.
Exactly.
Got it.
So that question could be mistaken many times, and a patient that is going through trauma of a new diagnosis will hear that and think that that's a given and that all doctors are connected to the same brain and they all know the same information. Obviously, that's not the case.
Thank you for watching CTOM TV. Subscribe below and stay informed.